Hi, good afternoon. My name is PJ Larive, and I'm the president of TM Solutions in New Orleans, Louisiana. And we're a laboratory that assists small to medium sized facilities that have ideas on creating a specific supplement or a nutraceutical. And we assist them in obtaining their goals in formulations and laboratory study and assist them in the manufacturing goals they require. Uh, the reason for this video today, and I'm going to try to do it as calm as possible, is the rapid blood test kits. Um, and the request from many facilities all over the world to assist their staff in the understanding of how the kits work and how it's used properly. So let's just kind of jump right in and give a complete explanation of the rapid blood test. And it's just that it's a blood test very similar to a sugar test where you prick your finger and you draw down a sample of blood. And now this test is being used in the US and the UK. And I want to be clear, it's not FDA approved, and I personally am not endorsing any kit at this time. However, the results from the kits that are in my office now and in my labs, we see are very promising with a very, very low false positive rate. Also, the specific tests we utilize have two areas to be sampled together on the same test unit, not unlike what the hospitals are using now throughout the USA, and that's called the RT-PCR test. That's the swab, the nasal swab, and then but they're having the patients wait 3 to 7 days for results, and these specific tests we're testing are being introduced and have a very quick response time, a very quick result time, 15 minutes. Now, these test kits are similar to, if to explain it to you, is like a pregnancy test kit. Of course, you're not pregnant, but if a young lady urinates on a test kit, a pregnancy test, it gives a positive and negative in pink, tells them if they're pregnant or not. But these kits are now very simply used with the same principle, a pink line protocol. And if you're able to follow directions, it's much like taking a glucose test, a single prick on the finger, and a draw of a small action of blood. And the test kits have markings that's embossed on them, and they're lettered like SC, IgG, and IgM. And let me define which each one of those indicators and what they do. The S letter equals sample, and this is where you're going to place your whole blood and your supplied buffering solution that comes with the kit. The buffering solution is a small 5 cc vial in most cases and can do approximately 60 to 80 samples. The IgM and IgG is the antibodies, and lastly, the C is control. Um, how the principle of the test kits work, it assumes that your patient is already infected with COVID-19 virus, and the body is producing an antibody to fight and protect the patient from the virus or bacteria. Now, with the blood test, it's going to give you an arbitrary value, which means basically that you are now infected with the virus, or your patient is now infected with the virus, or they were infected, or a carrier, um, or free. So normally, what happens with a virus, not only COVID-19, for example, um, a virus infects the body. After infection, our body's immune system produces antibodies, and the antibodies we produce try to attack and kill the viruses or bacteria. Our body produces more and more antibodies, being very repetitive. And once our body produces that specific antibody, the body gates that specific virus or bacteria, in this case, COVID 19. And that gives us the proof that the virus has already attacked the body. Also, keep in mind that one antibody is specific to one virus and one antibody is specific to one bacterium. So, what that means is that the antibody needs the virus to exist. We know the specific antibody for COVID 19 um, that we all produce to combat COVID 19, and this is what the kit utilizes. Now, remember earlier I mentioned the two other notations on the kit, IgM and IgG. Let's start with IgM. This is the prime immune response antibody. Your body normally produces an antibody when it is infected with a virus or a bacteria. The IgG is the antibody that is produced in the body when our body is infected with the same virus for the second time, third time, fourth time, and so on. So basically, if you have more IgG, it means you have been infected or exposed multiple times with the virus and probably have not taken proper protocols, PPE, masks, gloves, hand washing, etc. When you have on the test IgM with no IgG, it means you have been infected with this virus for the first time in your life. So we do a simple test, a simple needle prick. It's virtually painless, and we draw down a drop of blood. That's sufficient, and then we place that whole blood sample in the test area and drop 1 or 2 drops of the buffer solution. Now, the buffer solution is designed to take the blood up the test area. That's called the ability action. So you see, the test unit is going to read the action in the blood and see if the antibody specific to COVID 19 and if COVID 19 antibody is present. What happens in the unit is the blood and is drawn up the test slot by the buffering solution. And the first thing that happens in a minute or two, you'll see a line appear about equal, or maybe a little bit less than equal to the C that's printed. That's the control section. It means that the test is running correctly and the test has already begun and the blood is being taken up the test area and it's basically running correctly. If after about a minute, minute and a half, you don't see that pink line appear, before you consider that unit to be faulty, try adding 1 additional drop of the buffering solution to the area labeled S, where your blood droplet is. Um, then you will have to wait 15 minutes for results. If you see no other lines appear on the test area except the C, the control area, your patient is negative. If a line appears by the IgM and the control, your patient is positive. And this means they're infected with the coronavirus for the first time it happened in very recent time, within 7 to 12 days or within the last 12 days. And it also proves that your client is infectious and needs quarantine. Protocol should be taken in testing at your facility with the RT-PCR swab test on the nasal passages. If you see the line that appears IgM, IgG, that means a patient has been infected with COVID 19 for quite some time and is still infectious. Also, meaning they may not be showing signs of illness, however, they are contagious. It also defines a lot. It means that the patient has been COVID 19 carrier for over 2 to 4 weeks and is either in recovery phase and still infectious. It also can mean that they are still able to spread the virus to others, families, friends, infecting surroundings, especially without using correct PPE, meaning, again, face masks, gloves, and following CDC hand washing protocols. Once again, quarantine and follow the nasal swab. But keep in mind that patient is in a good place to survive, but still infectious to others. It also means that the patient in a way could be in a place of immunity of viral effects of the virus, but still infectious. It's still infectious to others and inanimate things. Now, if we see IgG line only, it means that the virus has been attacking that patient for a long time and has been exposed and possibly exposed others to the virus. Usually, this type of patient does not know he's sick, does not wear PPE, and describes himself as like a Superman, and always seems to state that they have a great constitution and he never gets sick, and they don't follow proper social distancing and don't follow mask and gloves along with hand washing. They just exist because IgG antibodies are creating a secondary immune response, or a third or fourth. The body creates this IgG antibody to fight a second and third or fourth wave of the virus. So let's recap. IgG and IgM, your patient is positive, and I have to stress to your patient to take it seriously and quarantine, and follow up testing with NPOP swab test on nasal passages. Good one is no lines except the control. Your patient is negative, and hopefully you like this information and find it useful. Look, I'm PJ Larive. I'm with TM Solutions in New Orleans, Louisiana. I appreciate your time and thank you.